My first experience with system of care was through the care review process, coming in as a mom, desperate for help.
Because of the way that they listened to me, and not only just listened, they incorporated it in decision making. It gave me the strength, I would say, to continue on and, to just keep moving forward. I think some of the biggest barriers is getting families in front of the right people to hear their concerns. Making sure that the local community, the families in a community are in front of the right people and they can hear their needs.
This isn't all about utilizing public resources, public dollars to apply and stem the tide of a problem.
So you would have physical health, mental health, YMCA, let's say, to help with social issues. Everybody, one team, one family, one plan, one team for this child and that family.
It's not just the social element, there's the financial element, the emotional element, all of these other functions that make for a healthy human being have to be recognized and supported.
We were introduced to the system of care that they provided this care review where you would sit at a table with, I think there was 20 people at the table from the school district, different providers in the area, people that knew about trauma. It was different community-based services. And we basically were allowed to tell our story and ask for help. We walked out with a sheet of paper with some recommendations on it that we were able to take then back to his professional team of doctors and therapists and say, this is what was recommended by the system of care.
Hey, we need to communicate, we need to work together, we need to collaborate. There's information that the birth parents can share with the foster parents can share with the birth parents, the agencies, the providers, all the people that are involved, the court, the whole collaboration. When everybody's working together and everybody's talking together, it expedites getting those children back into their homes, back into their communities.
It changed my life. I'd say saved my life. I was introduced to Youth Move as a transition age youth, transitioning out of the Department of Public Safety prison system. So here I was, a young 23, going on 24-year-old who was transitioning out of incarceration back into society. Although I was educated, had a degree, but I had absolutely no idea how to successfully transition back into with employment, with socially. It was so many obstacles in the way in reference to me interacting with people in the outside world.
They don't feel alone because, I'm not the only one that's struggling just to make a C. And they have a place where they feel they belong.
Being around people, positive individuals that were listening to my story and that were reciprocating the compassion that I had for them, they were reciprocating it to me and just hearing me out and going through the trainings, learning life skills and leadership skills that would help me progress and propel myself through life. It gave me something to be hopeful for.
The mantra for us is just making sure that, the right kids get the right service at the right time. And if we can structure our behavioral health system in a way that achieves that, it'll make all the difference in the world, and we'll have fewer kids going into out-of-home placement. We'll have fewer kids getting to that highest level of need, because if they get what they need, in third grade, when they're showing some symptoms of something, it could make all the difference.
We still haven't gotten the word that system of care is here to stay. It is not a program, it's a philosophy, and that everybody should embrace it. We have to keep getting that word out, and we have to keep getting people to really understand it's a family and youth-driven process.
All the systems working together. If all the systems work, the Department of Social Services and the juvenile justice systems and the hospitals and the out-of-home placements like group homes and residential treatment facilities, they're all working with the same population. It's the same child. It's the same family. Today it might be because he committed a crime. Last week it might be because he took some drugs at school, or he failed a test, or whatever. But it's the same child. It's the same family. It's the same population. If we were all working together, if we were all communicating, if we were all on the same team and not working in silos, we'd have a better community.